Good morning, everyone. Welcome to today's live update. I'm Chancellor Donde Plowman, and I'm here this morning with Dr. Spencer Gregg. Dr. Gregg is joining us as he does almost every Friday, but most Fridays from one of our vaccine clinics at the Student Union. Today, we are going to talk about vaccines, and then we will quickly go over data. So let's get started. This week, Governor Bill Lee announced that we, the entire state, will open vaccine eligibility to all Tennesseans on April 5th. And Knox County has already opened eligibility to everyone over 16 years of age. That is such great news. We encourage everyone old enough to get vaccinated. We encourage everyone old enough to get vaccinated. We have opportunities here on campus and opportunities opening up throughout the community. So, Dr. Gregg, what does this mean for our campus community?
Good morning, Chancellor, and happy Big Orange Friday.
Yeah.
You know, the state's announcement for making the vaccine available across all phases and ages over 16 is really great news. With this, we anticipate increasing the availability of the vaccine on campus. However, that will remain dependent on vaccine supplies to us from the state, but fortunately, those supplies are steadily increasing as well. Now that everyone is eligible for the vaccine, everyone needs to get the vaccine, along with following guidance for mask wearing, social distancing, and our other health and safety measures. It's really the only way we're going to be able to potentially get back to a pre-COVID life.
So, how will this universal eligibility impact our vaccine distribution efforts and how we are preparing for that as a campus?
Well, obviously, as more folks are eligible, it's going to place greater demand on our vaccine supplies. Knowing that, our Emergency Operations Center and Student Health Center staff are working on our different on-campus vaccine clinic schedules to permit as many vaccinations as possible. We're increasing our daily dose counts at the Student Health Center, and we're doing the same for our Student Union vaccine clinics. We're also planning other opportunities for additional mass vaccination clinics at the Student Union. Ultimately, our goal is to provide vaccine on campus to as many as choose to have it, and we encourage everyone to get it.
Oh, that's such great news. One more question. What vaccines are we receiving that we will be administering here on campus, and what can people expect from each of them?
Well, due to storage requirements and state distribution plans, we're limited to providing the Moderna and Johnson & Johnson vaccines on our campus. So that also means we can only provide vaccination to those 18 years and older because only the Pfizer vaccine, which we're not using, is approved for those 16 years and older. Both the Moderna and Johnson & Johnson vaccines, which we are using, are extremely effective in preventing severe illness that might require hospitalization or even cause death due to COVID. Both have similar side effect profiles. Most people do not have serious problems after being vaccinated. Your arm could get sore, you might develop some redness or warmth at or near the injection site. These symptoms usually go away on their own within a week. Some people report getting a headache, body aches, or a fever when getting a vaccine. But actually, these side effects are a sign that your immune system is doing exactly what it's supposed to do. It's working and building up protection to disease. Most of the folks to whom we've been providing the Moderna or Johnson & Johnson vaccine have been doing very well post-vaccination. They're really glad that they chose to receive it.
Okay, this is all such good news. So remind us one more time again how people actually sign up for a vaccine here on campus or anywhere else.
Well, to sign up for the on-campus vaccine clinics, you should go to the university's COVID-19 website at utk.edu/coronavirus. Again, for on-campus vaccine opportunities, go to utk.edu/coronavirus. Near the top of that page, click on the vaccine tab. By clicking on the vaccine tab, you'll open our vaccine information page. On the vaccine information page, you can see a list of vaccine events planned for on campus, both at the Student Health Center and the Student Union. Selecting one of those events will take you to that event's sign-up page where you can schedule an appointment to receive the vaccine, and you'll have access to the registration consent form that you should complete and bring to your appointment. Additionally, on the sign-up page, there are some important information education sheets about the vaccine that we encourage everyone to review prior to their appointment. I do want to caution everyone, there's likely to be a significant increase in demand for the vaccine with this recent eligibility expansion in the state. So if something is not available on campus for you as your schedule might permit, then you should look for other opportunities in the Knoxville and surrounding communities, like pharmacies and health departments where the vaccines are being offered. Throughout the community, vaccine sites are greatly expanding, and some are not even filling up, especially in outlying communities. You do not have to be a member of a community to receive your vaccine there. You can look for these off-campus or community opportunities by using the search tool at vaccinefinder.org/search. Again, for off-campus community vaccine opportunities, go to vaccinefinder.org/search. We actually have a link to that search tool on our vaccine webpage. There should be ample opportunities to receive the vaccine on campus and off, and we really encourage everyone to get it.
Wow, thank you so much. It's hard to believe it's been a year since this pandemic began, and it's so inspiring and relieving to see the vaccine being delivered to individuals every day on our campus. I've had the vaccine. I can't tell you the difference in the way my spirits were lifted, knowing that this is the key to getting back to the life we all want. So thank you so much, Dr. Gregg, for what you all are doing to make the vaccine available. And we'll all be patient. We're eager. So let's switch gears now to talk about the data. So as of this morning, we have 108 cases. 108 active COVID-19 cases. You look at that, we've all been following these numbers over the time period. 100 of those cases are students and 8 are employees. We now have in isolation, self-isolation or quarantine, we now have 363 people. So you can see the numbers have ticked up there. This includes 223 students who live on campus, 112 students who live off campus, and 28 employees. So let's talk about testing. Let's look at that data for a minute. Last week, we collected more than 2,700 saliva samples from students, tested them in pools of 3 to 4 samples. Based on those results, we sent 112 individuals to receive diagnostic testing. Of those who were tested, we identified 18 positive individuals, all residential students. The overall participation rate for residential students dropped again this week to 45.9%. Our positivity rate across all of the samples was 0.66%, so 66% of 1%. The participation rate has continued to drop every week in our residence halls, but we've had rising participation within our Greek community. So congratulations there. I've received requests from students asking for restrictions to be lifted across campus and in their residence halls or houses. We are in touch with the residents in halls and houses with participation rates above 75%, where we have been able to lift visitation restrictions. But our residence halls in particular are struggling to participate. In some cases, we're having to put restrictions back in place. So we're going the wrong direction, and that we need to change. I understand we are all ready for this pandemic to be behind us, and we are so close. But until we have higher participation rates or a critical mass of vaccinations, which we're working on, we cannot let our guard down. So please participate in the weekly testing and get a vaccine as soon as you can. This helps us prevent it from spreading quickly. Having a vaccinated campus community, especially within our residential population, is key. It's absolutely key to our ability to move beyond this moment and these restrictions. So Let's just summarize here. If you look at our metrics summary, as a reminder, this table includes indicators that we use to evaluate the situation on campus and whether we can tighten or ease temporary restrictions. This is all, again, on our website, which I know everyone's familiar with. So, Dr. Gregg, let me go to you. How are things trending in our broader community?
Chancellor, as you can see on campus, both our active cases and new cases are trending upward, as are our overall self-isolation. So we're certainly not heading where we want to be. As you've alluded to, this is not what we need to see in order to overall de-escalate current campus restrictions. Actually, it puts us at considerable risk for having to increase those restrictions, which you've noted we're already doing in some residence halls. In the greater Knoxville community, we're seeing more of a plateau in regard to their numbers. Their new COVID cases per 100,000 are holding steady, maybe decreasing some, but are still above 10, and ideally that should be fewer than 5 per 100,000. And we're also seeing some increases in hospitalization and intensive care unit use in some cases. All this points to the fact that we're not out of the woods yet. We have to stick with the program. We all must continue to wear our masks, continue to socially distance, avoid gathering in groups where folks are eating and drinking, and where these guidelines aren't being adhered to. These are our greatest risk situations, and we need to avoid them for a bit longer. Get vaccinated. The end is in sight, and we need everyone to keep up the good work. We must, in order to be successful in reaching our goal of a community without the fear of COVID.
Thank you so much for that helpful information, as always, Dr. Gregg. As I said last week, we are at a critical point in the fight against this pandemic. As we continue to see vaccines distributed, it's bringing us closer to achieving some level of normalcy. We don't want any setbacks at this point. No setbacks now. So let's remain vigilant just a little bit longer. Wear your masks. Keep your gatherings small and distanced. Spend more time outside and get your vaccine. We can do this. We're Vols. Thank you all and have a great weekend.